Lady of the United States, I had the opportunity to travel around the world and meet people from all walks of life. But some of my most important work was when I visited with people in crisis. Refugees who were forced to flee from their homes due to the threat of terrorism, civil war, natural disaster, or religious persecution. I met with families who are displaced and struggling to create a new life, keep their kids in school, and maintain a sense of normalcy amid tumultuous circumstances. I met so many young refugees whose childhoods had been stolen. I saw children struggling with hunger, girls who had been trafficked, boys who had been forced to become child soldiers. But at every refugee camp, in the midst of every famine, in hurting communities and war-torn villages, I saw something else as well. Organizations stepping up to meet critical needs, providing food and vaccinations, building schools, helping communities rebuild, and saving lives. Now, through my work at the Biden Foundation, I want to keep the spotlight on these families and their struggle, as well as their strength and resilience. In the face of adversity, they find the ability to start over and work toward a better life. As an English professor for over 30 years, I am especially committed to supporting education for displaced children. Providing a safe place for children to learn not only helps them normalize their situation, but gives them a foundation to lean on for the rest of their lives. In distressed areas across the world, aid workers, government representatives, and goodwill volunteers devote so much effort to providing a safe place for refugees to live, work, go to school, and start their lives over. We are deeply committed to helping them do their jobs the best they can. We now have a unique opportunity to provide support to refugees worldwide, whether in government, nonprofits, or the private sector. We all have the ability to affect change and make sure that no refugee, no family, no girl or boy gets left behind. We do it because every child deserves a childhood, the chance to make a life worth living. Because children who can learn and play, who don't struggle with violence or forced marriages or hunger, grow up to be smarter, healthier, more productive adults. Because those adults become better parents and teachers, build stronger communities, cure diseases, and promote peace. We have an obligation to keep these people in our hearts and minds.
Ladies and gentlemen, to introduce the session, Response and Recovery, Sustaining Health Services in Insecure Settings, please welcome to the stage, Chair of the Biden Foundation, Dr. Jill Biden.
Hello. Hi. Well, they took Yo-Yo Ma. And I just loved hearing him because doesn't he make you just feel like you can breathe? And we all sort of need to breathe. Well, we are meeting today in the wake of several natural disasters that have made this topic feel especially real to so many. I was just in Houston last week to help with the recovery efforts after Hurricane Harvey. A patient with kidney failure who, without electricity, couldn't receive life-sustaining dialysis. A doctor who had to canoe to a hospital to perform a vital surgery. A midwife who used an inflatable swan pool toy to float her tools during a delivery. I saw how critical health service that we take for granted can become completely inaccessible. And then, of course, just 2 weeks later, Hurricane Irma brought even more destruction. Today, other storms loom near. Natural disasters, political unrest, and epidemics remind us every day that sustaining and building strong healthcare infrastructures for insecure settings is more urgent than ever. We can't be caught improvising in times of chaos. We must be prepared. As you saw in the video, I saw this need all over the world during my time as Second Lady. Back in 2011, as many of you know, East Africa was facing the worst famine in 60 years. Parenthetically, a worse famine persists throughout Africa today. The numbers were staggering. 13 million people at risk, 29,000 children dead in 3 months, and getting worse as the days passed. Action was needed. Americans just weren't paying attention. So we organized a trip to the Dadaab refugee camp in Kenya. We arrived early in the morning. Heat, searing heat, slammed us in the face as we deplaned. A dry, dusty, gusts of wind, tumbleweeds. The camp was overflowing with people, some who had walked for days or weeks to get there at all. There were so many that hundreds had been turned away and were sleeping along the fence outside, hoping to get in. One woman set out from Mogadishu, 710 kilometers from the camp, with her 2 small, starving children. She'd walked for days without food or water, facing the constant threat of violence. And along the way, her children became dehydrated and could no longer walk on their own. She too was weak, and she could carry only one. So she picked the one child who was healthier, the one who stood a better chance to live. And she left the other by the side of the road. That story is hard to tell even now. Around the world, horrors that are too heartbreaking to imagine for those of us who have always enjoyed a stable home, clean water, domestic peace, are unremarkable for so many. But our moral sense calls on us to do more. But if we hope to lift the unbearable burdens of our world, it starts at the beginning with health. You all know the challenge well. Without medical care and needed treatments, illness spreads like wildfire. Preventable diseases keep people from work and children from school, and poverty becomes ubiquitous. Women can't plan their families, and children are born into communities that can't support them. Without economic opportunity, some turn to violence. Communities become less secure, and that violence leads to even more unmet health needs. And the cycle continues to feed upon itself. In fact, in the Obama-Biden administration, we prioritized global health and its national security implications. We knew that health threats anywhere in the world could be a danger to us here at home. But in my work, I saw how this cycle could be stopped. When we made basic investments in a community's health and development, medical care, better nutrition, quality education, those investments pay dividends for generations. In other words, investing in healthcare in insecure settings isn't just the right thing to do. It creates a safer and more prosperous world. This summer, my husband Joe and I attended the Concordia Europe Summit in Athens. While I was there, I visited the refugee camps on the island of Chios. There, I met a woman named Rosa, who had fled from Syria with her 3 young children. Her story was as tragic as it is common. Rosa was married when she was a child. Her husband was a professor. She had her first baby at the age of 12. Her family had struggled to keep food on the table and a roof over their heads. The schools around them eventually closed. They lived through years and years of war. One morning, she woke up to the sound of an explosion and found her children covered in shattered glass. So they made the decision to make the dangerous trek to Chios, sleeping on the streets, braving violence along the way. When Rosa reached the camp, she was weak. Her children were suffering from hallucinations, nightmare, and sickness. But thanks to her Greek hosts and international aid organizations like Save the Children, we at the Vial Hotspot, Rosa and her children all are slowly recovering. Her kids, 8, 4, and 2, are getting counseling and treatment for their trauma-induced illnesses. They have a safe place to play. They can take classes and begin their education again. The mental and physical wounds of war still linger. And often, our most vulnerable communities face not one, but a perfect storm of intersecting dangers. The obstacles are big, and the solutions are incredibly complex. They require us to come together across sectors, across disciplines, and across nations. That's why this gathering is so important. Thank you to Christina and Konstantin, Nitsia and George, Monica and Nicholas, and Matthew for your hearts, your work, and for calling us together to make a difference. And thanks to all of you for your commitment. It's time for action. Joe and I are with you, and through the Biden Foundation, we will continue working with you in this work. Thank you.